Hello, Vincent Obita here again, and we proceed with the session of care planning for our OSCE patients. And under this episode, we are going to cover care plan for a patient who is and having end of life care, and you are supposed to provide a care plan based on your assessment findings. And in this case, for the worst case scenario, we usually have a patient with congestive cardiac failure, and that's the patient we are going to tackle today. Now, the patient care problems will depend on the scenario that you will be given during your OSCE examination. And now, based on that scenario, develop your problems and right from the assessment, establish which two key points you are going to cover during your care planning. For instance, with my patient here, patient is having congestive cardiac failure, and I'm going to cover instances such as problems such as breathlessness that is resulting from the congestive cardiac failure, and also sleep disturbance, which is also due to the breathlessness. Okay, so those are two potential care plans that you can give consideration. So for this case, these are still a news patient, so you will just follow the format for news care planning, and you will be given patient details. Okay, so you kickstart from the nursing problem, and nursing problem 1 here, I'll stay, and my patient, I'll give him a name of Miller. I'll state that Miller is experiencing breathlessness due to congestive cardiac failure, and I have to evidence it by the respiratory rate of 26 breaths per minute. From there, I move to the aim of care, and your aim of care have to be measurable. Aim of care in this case, I'll state that Miller will have a respiratory rate of between 12 and 20 breaths per minute following nursing intervention. You can also write Miller will have improved breathing and have a respiratory rate of between 12 to 20 breaths per minute. Remember, time is of essence, so make your sentences as short as possible, but also capturing what are critical for the examination. For the reevaluation date, reevaluation date will base on your news score. If your news score required you to assess your patient after every 1 hour, then that's what you indicate at reevaluation date. And that's the case with mine. I stated to be evaluated today. Ensure to write that today or write the date, whichever you prefer. To be evaluated today, every 1 hour, or more frequently if the condition changes. Okay, with that one, I'm good to go. Then now I move to the care by nurses, and care by nurses, you remember hematurid, that's mnemonic, that's what you follow, and you can modify it to fit your situation. So explain and discuss all aspects of care and gain consent. 2, you go to the monitoring bit, and this must align to the news statement that you need to state, monitor and record Miller's vital signs every 1 hour as per news policy, and escalate to the nurse in charge as required. That statement have to be captured in that manner. Then the next point will be administer prescribed medications, okay, and check their effectiveness. From there, I move to the 3 specific points for breathlessness, okay, and in this case, the 3 specific points will be teaching Miller deep breathing exercises and repositioning technique to improve the breathing. Okay, very direct. The intervention and its rationale. Okay, you have to maintain that one. Apart from that one, there's also the aspect of assessing Miller's respiratory rate, checking for any sign of respiratory distress, such as cyanosis or use of accessory muscles. That is very key, especially that is key and also specific to the patient. Beside that one, you can also give considerations such as referring Miller to respiratory specialist as needed or for further assessment. The three turns out to be specific: positioning, assessing the respiratory rate, and referral to the respiratory specialist. From there, you clear by stating instruct on the proper use of call bell because this patient is in the hospital setup. Then document all care as planned. With that one, you are done with the care provided by nurses. Then you shift to the self-care activities of the patient, and they are common for the care plans provided the patient is within the hospital setup. So for this case, you can state Miller verbalizes understanding of his care plan. Miller verbalizes the understanding of the health education given. Miller demonstrates proper use of call bell, okay, and things of that kind. With the 3 points, you are good to go. You can also add Miller actively takes part in his own care. After that, with that one, you are done with care plan 1, and that one should be captured within 6 minutes. So you need to be very fast, brief, but also capturing all the aspects that are required from you. From there, you shift to the second nursing care problem, and in this case, my problem is sleep disturbance. Remember, this sleep disturbance, I captured it from the patient's scenario, and also during my assessment, I inquired about it from the patient, and I've gained information concerning the sleep disturbance. You must have the number of hours that the patient is able to sleep. So don't just identify the sleep disturbance. If you don't have definitive information about the exact number of hours, then it will be null in terms of your nursing care problem. So when you've identified that your patient is having sleep disturbance or sleep disruption, then you should probe more during your assessment to give you the information that you will use during your care planning. And now for my nursing care problem, I'll state that Miller is experiencing sleep disturbance due to breathlessness and frequency of micturition, as evidenced by patient sleeping for only 4 hours. So the 4 hours is the evidence, and it should reflect what you had probed during your assessment. You should not maybe initiate your new evidence at that point, because remember, when you are doing your assessment, the assessor was there, so he or she will be aware of what this patient is encountering. So you should not initiate anything new or provide anything that has no evidence from the patient scenario. Then my aim of care will be Miller will be able to sleep between 6 to 8 hours following nursing interventions. Okay, that is measurable because you will ask the patient if the sleeping hours have increased. So the 6 to 8 hours is a good sleep. That's a good period for a sleep, and it will meet the needs of this patient. Then I'll go to the reevaluation date, and that's where you also, as I said earlier, you need to be very keen with your evaluation date and time. For instance, this is sleep, and remember, you will have interventions towards improving the patient's sleep. So for the reassessment, it need not to happen after 24 hours or after overnight or that. Remember, there are interventions you put in along the day to help the patient improve their sleep when the sleep time comes. So you need to take note of the reevaluation date. So you, in my case, I stated to be evaluated every 1 hour. You can also state to be evaluated every 4 hours, okay, or more frequently if need be or if advised by the doctor, okay. uh, don't place a very long period like 24 hours, because there are interventions such as which we are going to look into as we talk about care by nurses, that you would assess their compliance before even the bedtime reaches. So care by nurses, we get straight away hemataried. For explain and discuss all aspects of care and gain consent. 2, it's still a news patient, so the news statement still stands. Monitor and record Miller's vital signs depending on the news score. That's what you will use every 1 hour as per news policy, and escalate to the nurse in charge as required. Then the next point will be administer prescribed medications and assess their effectiveness. From that point, now you give the specific points for sleep disturbance. And in my case, I can give, for example, dimming lights and keeping the room quiet to induce sleep. Intervention rationale: dimming the lights and keeping the room quiet to induce sleep. I can also provide the comfortable position for Miller. Remember, he is having difficulty in breathing that is impairing their sleep. So I can provide comfortable position, but maintaining a semi-upright posture or a semi-upright position to enhance their breathing, and in that case it will encourage sleep, because they will be having ease in their breathing. Then the third point that is still specific to the patient is the referral. I'll refer to the sleep specialist as needed to improve Miller's hours of sleep. Okay, with that one, I have my 3 specific points for the problem, and I'm good to go. Then I finalize by instructing Miller on proper use of call bell and placing it within his reach, and also documenting all cares are planned. With the 2, I'm done with my second care problem. There's also the bit of now printing your name, placing a signature and the date. Endeavor to capture those ones, because should you write a nice care plan but it is not signed, that's null and void, and you will be invited to receipt for your examination, and that's not very cool, in that is something that you can capture, and endeavor to clear in time so that you are able to recheck some of the few things that can take you back. Okay, with that one, you are done with the care plan for this patient. Now, in the next session, we will cover the evaluation for this patient, which is relatively different from other evaluations, because it has aspects of spiritual needs and also risk of deterioration. So see you then, as we will be discussing the evaluation for the same patient we've covered today. Thank you so much, and bye. See you next time. Wish you success as you are going to undertake your OSCE exam, and go there confidently and smash the stuff, and you will just join the big team of Band 5. Bye. See you then.